There we go. Sorry, start again because now it's recording. My name is Jackie Jacob. I am one of the extension specialists at the University of Kentucky. I'm also the coordinator for the Small and Backyard Flocks Community of Practice. And as such, I help organize these monthly webinars on a variety of topics of interest to small and backyard flocks. We had done a webinar, David had actually, Dr. Frame had done the webinar a couple of months ago on performing a simple necropsy. And we had a request for a follow-up on something to do with common poultry diseases. And you have a wide variety of people here from, we got North Carolina, Ohio, Alabama, Washington, Colorado, North Dakota, California, Connecticut, and South Carolina. So pretty much covered the board here for you. This webinar is being recorded, as I said. Oh, and Maryland, I forgot Maryland. And it will be available for follow-up viewing if you would like. I will put the different websites that you can look at for information for upcoming webinars, because we have one in June on butchering chickens and one on July 7th on managing egg-laying hens. So I hope you'll join us for that. If you have a question during Dr. Frame's presentation, please type it either in the Q&A, which is probably the best place, or in the chat box. I will be monitoring both during the presentation. If the presentation has something to do with what Dr. Frame is specifically for that, you know, with what he's talking about, then I will pop back up and interrupt him and ask for clarification on the point asked. If not, the questions will be saved to the end. And I think that's all the, we already had a question, are those for the producers or for extension agents only? All webinars are open to anybody in the general public, free of charge. And we did have one more person indicate their location from Puerto Rico. So you really do have a very diverse audience. So I will go on mute and turn it over to you, David. You can share your PowerPoint and go for it.
Great. Thanks, Jackie. And I come from Utah, so that kind of complements everybody else. So we tie the whole U.S. together here. And what I've got for you today is some general diseases that affect backyard birds. And there is a little bit of variation depending on where you're at, obviously, but some of these are pretty common to everything. And so what I'm going to do right now is share my screen. It says the host disabled participant screen sharing, Jackie. Can you get me on there? So what we're going to do is cover...
Be able to now.
Okay, a few topics, the different systems of the body, and then just some of my experiences too, and then just some miscellaneous type diseases. So first we have to define, I guess, what health is. Health is really just the absence of disease, and most of us feel fairly healthy, but every once in a while we have an ache or a pain. But as far as our poultry go, we want them to lay eggs well, we want them to grow well, and these are healthy birds. And so some of the things that might affect this health, we're going to visit about. First of all, let's talk a little bit about how diseases can be transmitted. If you look at the top of this this chart, we have a chicken over here, and direct transmission of disease is that the pathogen or the virus or bacterium or whatever it might be can be directly transmissible to another bird. And let's think of ourselves in a movie theater, and somebody sneezes and those droplets carry virus or bacteria directly to the person sitting in front. That's direct transmission. Another thing that can occur is indirect transmission, where say the organism is excreted in the feces, say an egg of a worm, for instance, and it's picked up by an earthworm, and then the next chicken picks that one up, and that way it gets that organism into its body, not directly from the chicken who deposited the worm, but from another source. This is called indirect transmission. And then one that's really important as far as some of the regulatory diseases go, or is the transmission through the egg. This is called transovarian transmission. And in fact, that's the reason why the National Poultry Improvement Plan was put into effect. And we won't go into what that is, but it's an organization that helps particularly commercial growers to make sure that their birds are free of disease. And in fact, as you buy your chickens from feed stores and other places, be sure that those birds you're buying come from NPIP certified hatcheries, and most in the chain feed stores and things will, so that shouldn't be a problem. So regardless of how the bird gets infected, once it's in the coop and among its flock mates, there can be lateral transmission by either of these methods that we've talked about here before. So just kind of keep that in mind as we go through it. Let's talk about respiratory diseases first. And the respiratory system of a chicken is different than ours. They have 9 air sacs, and these air sacs are just a repository for the air that they breathe in that goes through the lung. Now, the lungs of the chicken are not expandable like ours. That nice picture that Jackie had of those balloons behind her, the chicken's lungs do not expand and contract like that. And so the air goes through them and into these air sacs and then back out through the lung and then out. And so this poses some anatomical situations where there can be some disease in areas of the body of the chicken that that we don't have, like air saculitis. So that's kind of the anatomy there that we want to think about too as we go through this thing. Now I want you to look at this chicken for a minute and just think of what's wrong with it. What part of the body is wrong with this chicken? And when I first saw this bird, it was first presented to me, you know, it's down on its hocks, you think, oh, it can't walk. Well, actually, this bird has a respiratory problem, and the reason it can't walk is because it couldn't breathe. And this chicken suffered from what's called infectious laryngotracheitis. And every once in a while, it would kind of gasp and gape. Now, the old traditional picture that's found in the old textbooks is of a chicken that's gasping and it's gaping. It just can't get the air from it that it needs. And this is very typical of what you'll find with LT, with laryngotracheitis. And the reason for that is because it affects the trachea and plugs the trachea up with mucus and with blood and all kinds of things. So here we have an open trachea of a bird that has suffered from LT. It's filled with bloody fluid. Sometimes the trachea itself can slough off and lodge down in the windpipe so that it can't breathe. And just for your interest, here's a picture of the tissue, and that virus will cause these macro cells to form down in there, and then you've got this layer of dead material and of debris that's causing problems breathing. So a characteristic of laryngotracheitis is that they oftentimes kind of gasp for breath, and vaccines for LT are usually regulated by the state. And so if you have a diagnosed problem with this, then you'd have to talk with your state on what is legal and what's available in your particular state. Now, infectious coryza is a bacterium, and it's called Avibacterium paragallinarum, and it's found throughout the U.S., but generally in more temperate climates, although it can be found in a lot of different places. And the clinical signs of this will be kind of swollen eyes, and they'll be coughing and sneezing, and it has a very marked odor to it, and so it doesn't smell very good. And the problem with this disease is that the carriers can be recovered from the disease and never show it. And this is one disease you have to kind of watch out for if you take birds to fairs, because if your chickens are naive to infectious coryza and they come in contact with a bird that has had it and has recovered, one of these typhoid Marys, then you can have some real problems. And I know that firsthand, because this disease about wiped me out of my exhibition birds one time. There is a moderate decrease in egg production if you've got a small flock that you've got. And like I say, once they recover, they can look normal, but they'll carry it on. And so if you have a consistent problem with it, there are some vaccines available out there for it. In the old days, they used to do what's called a controlled exposure, and so the older birds were exposed to the younger birds because they don't react quite as bad, and then they recover and they're fine. But that's not a that's not a way that I would recommend doing it. Like I say, the eyes are often affected to the point where the eyelids are closed, and if you open those eyelids, you can sometimes get cheesy material out of there. And once they recover, even though they look good, they'll still have it. Now, another respiratory disease that is a rule out for any kind of a cough or a sneeze or drop in egg production is infectious bronchitis. Interestingly, this is caused by coronavirus, and we all know about coronaviruses pretty much nowadays. This coronavirus is only distantly related to the coronavirus 2 that's causing the COVID-19 problem. And there's no indication that COVID-19 infects birds. There are some mammals that it infects, but as far as the backyard poultry and things like that, you're safe from that. This particular coronavirus will cause a cough and a sneeze, usually no ocular or nasal discharge with it, but there is a drop in egg production. And one of the hallmarks of some of the strains of or serotypes of infectious bronchitis is misshapen shells and watery albumin. I'll show you a picture of those shells in a minute when we get to the differential diagnosis here. Transmission carriers for months, and it persists in the environment. And there's different strains of infectious bronchitis, and in fact, some strains will cause some kidney problems. Those that cause kidney problems usually do not cause a situation where there's respiratory signs. Another respiratory agent we have to be aware of is Newcastle disease. It's very prevalent. The avian paramyxovirus 1, or APMV1 as it's often called, is out there. A lot of birds can carry it. Again, there's a cough and a sneeze, and there is a drop in egg production. And also there's misshapen shells and watery albumin. And so it's going to take a differential diagnosis from a diagnostic lab to really pinpoint this for you if you have those type of problems. Virtually every species of bird they've tested is susceptible to some form of this avian paramyxovirus 1. And not all of them cause a lot of serious disease. And in some birds that are susceptible, it may not show any problems at all. However, there are certain ones like the pigeon paramyxovirus that causes problems in pigeons, and this Newcastle disease that causes problems in turkeys and chickens and other things too. It's usually a respiratory problem. However, you've probably heard in the news about this virulent Newcastle disease. Now, this is something you're not apt to find in your backyard, but if you do have a lot of interaction with birds that come from other areas, that's always something you've got to watch out for. But the hallmark of this virulent Newcastle disease is sudden death. You'll go out there and your whole flock could be dead. And there's a lot of hemorrhages and things on the inside of the organs. And this is the true stomach or the proventriculus of a bird that's been infected with virulent Newcastle disease. Not something you're apt to find, but just so you're aware of it. So now we get to the egg situation. All of a sudden your hens start laying funny looking eggs like this, and the shells may be misshapen, and if they're normally colored shells, they may be pale or not colored at all. And you open these eggs up in a frying pan, and it just spreads all over the pan, and the yolk isn't held up there nice and tightly like it should be. So what's going on? Well, we've talked about a couple of diseases that affect the respiratory system, but obviously they affect the oviducts too of these hens, and this is what you're bound to get. And so, reviewing one last time is that it could be bronchitis, it could be Newcastle. Both of these could cause these type of things, and you could have Newcastle go through your chickens too without any clinical signs. So. Other than maybe something like this. So you have to have a firm diagnosis if you have either of these, because of course the situation is such that vaccination, if you so desire to do that, would be different. And just my own opinion on vaccination, by the way, is that I wouldn't vaccinate for anything you don't have to. First of all, you don't want to start a problem because some of these vaccines are live, and you don't want to get anything on your place that you don't have. And so unless you have a reason to vaccinate for any disease other than one that we'll talk about here towards the end, I wouldn't do it. Now, another respiratory disease is often called MG, or chronic respiratory disease. It's caused by a very small primitive type bacterium called mycoplasma, and this one is Mycoplasma gallisepticum. Again, you can have a cough, sneeze. Often there's nasal discharge with clinical MG, a decline in egg production also. But in chickens, there's often no clinical signs because one MG strain is not necessarily the same as another, just like we talked about the Newcastle. And so they could be infected and show no clinical signs. However, they do come into play here in a minute on the respiratory syndrome we'll talk about. Transmission is bird to bird, and it's egg transmission, and this is where the NPIP came into play. This is one of the diseases that are egg transmitted and will cause problems in chicks, and so the hatcheries, the commercial hatcheries, anything that is reputable, and most hatcheries are NPIP certified Mycoplasma gallisepticum clean, as well as the Salmonella pylori and Salmonella typhoid. Now, this is something that I see quite regularly in this part of the country, and maybe in other areas you don't see it so much, but we have some cold winters, but we also have some times when it's really cold and it's really hot. For instance, where I live, it's about a mile high, 5,500 feet above sea level, and we can fluctuate 50 degrees Fahrenheit from the hot of the day to the cold of night, and so that could put a little bit of stress on some birds. However, what you often see sometimes when it starts getting cold is you get this snick or this cough and this sneeze type thing in the birds, and there's usually no nasal or ocular discharge. It's just this kind of a coughing, and I think it's because the birds are put under stress, and there's multifactorial causes of it. If you're closing up your building, you could have some dust in there that's contributing to it, or if you have a lot of birds in there, you could have some ammonia buildup too. And there's some pathogens that are involved. And we actually did a study, a small study here in northern Utah, surveying flocks, backyard flocks, for 3 important respiratory diseases. And in the past, I just assumed that most of that was due to MG um, in chickens, because a lot of times they don't show any signs, then they're under stress and they start showing a few signs. However, it was very interesting because the Mycoplasma gallisepticum antibodies, we found that it's very variable in backyard flocks, and a lot of them are actually MG free. Newcastle disease, thank goodness, that the prevalence of that was none. We did find a couple of blips out there, particular birds, specific birds, but as far as flocks go, Newcastle disease is not, doesn't seem to be a real prevalent problem. However, the thing that surprised me was infectious bronchitis was very prevalent out there. And so I think that is one of the issues in this respiratory syndrome that may be underdiagnosed. And so that was very interesting to see that. And so I don't know how many of you have seen this kind of a syndrome it's kind of a non-specific thing, but it's something that occurs in this area of the country. And this, to my knowledge, this is the first time any kind of a flock survey had been done, and for sure in Utah and in the Intermountain West for sure too. Okay, so we've been talking about respiratory diseases, and say your birds have this gasping, gaping problem, and you do a necropsy on them. You look in the trachea and you see all this bloody, red-looking stuff. Well, we've already talked about one disease, ILT, infectious laryngeal tracheitis, that can cause a lot of blood and mucus in the trachea. But if you look really carefully at this thing and tease them out, what you'll find is this is actually a parasite. This is the gapeworm, and the male and female will tie together and then stick in the trachea, and then they'll produce eggs, and the eggs will go down the trachea. The chicken will cough them up and swallow them, and then they'll go out into the feces. And so this is common in some areas of the country. We don't see it in the Intermountain West, thank goodness, but I know in some areas of the country this could be a common problem for particularly flocks that are out in pastures or out where they can have access to earthworms, because earthworms are the main intermediate host of these gapeworms. So that, even though we'll talk about parasites in a minute, this is one that I wanted to put in the respiratory end of things because of its uniqueness. Okay, so let's talk a little bit about digestive diseases and abnormalities. And this is where the rubber really hits the road on a lot of things. But first, let's get oriented. Here is a chicken that's opened up, and we've got our heart up here in our liver, and we have the esophagus coming into this true stomach called the proventriculus. Now, if you remember when I showed you the pictures on virulent Newcastle disease, this was the organ that was cut open that we looked at. And so that's the true stomach. It goes down into the ventriculus, or the gizzard, and then it goes into the small intestine and down and so forth. And just so you're oriented, this is the one of the lobes of the left kidney. This is actually the ovary of this chicken. It's obviously a female, and it's not in production. And then this is the lung, and I mentioned that it's kind of packed inside those rib cages there. You can see that it doesn't have room to expand and so forth. So that kind of gives you a little bit of an orientation. This is probably the disease that you'll get that's the most common out there as far as digestive diseases go. And this is coccidiosis, and it comes in various forms in backyard chickens. There's a number of different species, and they'll infect certain areas of the gut. It's really not important to know that from your standpoint, other than the fact that here's the outside of the intestine, and you can see these little red spots. That's the coccidial organisms inside of the gut that are causing so much trauma that you can start seeing it from the outside. Some species will cause blood to occur inside. Here's one species where you can see that there's a lot of blood inside. Now this thing has been cut open now, and we're looking at on the inside of it. Others will not form blood, but will maybe thicken the inside of the intestine a little bit. That's called the mucosa, or cause some lesions inside the mucosa that are very typical. So if you were to have chickens that became very lethargic, and you suspected there was a problem, and you did either a gut scraping or a fecal flotation on them, and you saw all these little round things, this is enough to alert you that you've got a problem here that probably ought to be taken care of. Now, coccidiosis will often come in a flock after there's been a real dry spell. These little guys have to sporulate before they're infective in the bird, and so they can be shed out in the feces of the chicken into the litter, and if it's dry, they won't sporulate. However, as they build up in the litter, the chickens aren't apt to pick up a lot of them. You want them to pick up a few so they get some immunity. But say a water line breaks, or whenever your water spill over, what's the first thing that chickens do? Well, they're curious. They go over and they start pecking at the litter. Well, two things are happening. Number one, the liquid allows this organism to sporulate, and then the second thing is the chickens are apt to pick up a whole slew of those sporulated oocysts, and then they can show signs in just a few hours of some really bad something. They'll be hunched over, they look like they're going to die, and oftentimes they will if they're not treated correctly. So coccidiosis is one disease that shows itself if those chickens have had a bad ingestion of these things. Often what goes on with coccidiosis is the condition of a bacterium called Clostridium that doesn't grow in oxygen. So in fact, it's anaerobic. Oxygen will cause it to go into these kind of cysts, and they're not effective. But once in the gut where there's no oxygen there, they can cause some real problems. And sometimes what will happen is the coccidiosis will damage the gut to the point where the Clostridia will get in there and cause further damage, and it just sloughs the inside, the mucosa of the gut right out. And here's a couple of cases of necrotic enteritis. And as I mentioned, a lot of times these two will go together. Up here you can see some coccidial damage from the coccidiosis that it has, but also the mucosa is thickened and will slough off, and so sometimes you end up treating both coccidiosis and the clostridial problem in real severe cases. Ulcerative enteritis is one that's probably not that common in backyard adult birds. It's mainly a disease of partridges and quail. However, I have seen it in pullets and young chickens before, and it's related to the Clostridium that causes the necrotic enteritis. However, this acts a little differently. First of all, if you open this bird up and you saw these little white specks, it looks like you're looking up into the night sky. I call it stars. You know, it kind of looks like you're looking at stars. The next thing you want to do is look down at the gut, and you see these little punched out areas like that. Well, that's the clostridial organisms that are causing that, and so it's more localized than the Clostridium perfringens was in the necrotic enteritis, and these things will often ulcerate right outside the gut and cause a peritonitis or a problem inside the body cavity. So it's not as common as the necrotic enteritis, but I have seen it occasionally. Some things that are due a little bit to management, okay? Impacted crops. If we can get oriented here, the head's up this way, and here's the opening into the body cavity, and the crop is right here, so that the esophagus goes down into the body cavity there. You can see that this bird has been eating a lot of fibrous material. sometimes what causes that is that if they're hungry and they're let out into a pasture or a weed patch or something like that, and they figure that this is something to eat, and they start chowing down on things, they can get impacted there in the crop or in the gizzard. And it doesn't take a lot of imagination to realize that feed isn't going to get past a lot of this stuff. In fact, you can see in the intestines, there's not a lot of feed in those intestines. And so some, this is going to stay there for a long time if it ever does get out. Some things that they eat, I've seen them, I don't know if you know what horsetail is, equisetum, but I've seen them get to the point where they've got equisetum completely um, impacted in the crop and the gizzard, and this stuff of course won't break down very well. So it's kind of, just make sure that if you're introducing your birds to any type of vegetation, particularly the stuff that's kind of woody, make sure they're full by the time they get out onto it, and that they won't try to engorge themselves on it too much. So some parasites, we talked about one of them. Let's talk about other internal parasites and then some external ones. Now this is the most common one. This is the roundworm. It can get so bad that it blocks the intestines. We talked about crop impaction with feeds, with plant material further up. These things can get so bad that they block the intestines, and then the birds will become thin. They don't thrive like they should. And there's a direct life cycle with this. So in other words, these adult worms in here will produce eggs that go out into the feces, and then the flock mates can just pick those up directly from the litter. There are some, every once in a while, somebody will call up and say, I've got a worm in my egg. Well, actually oftentimes what happens is that these roundworms will get in the wrong place, and they'll start down the oviduct, and then they'll be integrated right into the egg. And so there's really not the worms in the oviduct itself or in the eggs. It is in the egg eventually, but it actually comes from the intestines. So if you've ever heard of that, that's usually what this is, the roundworm that causes that. If you were to do a scraping on these things, on the guts or fecal flotation, you'll see these are a lot bigger than coccidial organisms. A coccidial organism would be, I don't know, maybe a little bit bigger than that thing compared to these worms. And so, and that's a fairly common situation, particularly if you don't clean your litter out too often, and it can build up in there too. Another one is capillaria, often known as threadworms, and you can see exactly why they call them threadworms. They're very thin. The capillaria can either infect the crop and cause it to thicken, or it can get down and infest the intestines and cause some thickening there. And they're usually not seen very easily. You can, if you kind of know what you're looking for and you kind of scrape around and dig around in there, maybe you can find some of them, but they're kind of hidden away compared to the ascarids. And they produce an egg that's oblong, it's fusiform shaped, it's got operculated plugs on it on each end, and it's kind of a golden color. Now we talked about the gapeworm. The gapeworm has an egg that looks a lot like this, except it's very golden colored. But these can cause some digestive problems, as we can well imagine too, if they get underneath that mucosa in the gut. Tapeworms are something that probably chickens, as they're out and about, particularly in swampy areas or wet areas or whatever, can pick up tapeworms. There's a lot of different species. They usually don't cause a lot of problems. I think they cause more trauma to the owner than they do to the bird. However, if there's enough in there, they can also compete for nutrients inside the intestines of the bird. And I have seen cases, one particular case where I believe that the tapeworms came from these turkeys eating grasshoppers, but it did stunt the growth of the turkeys. And so they can cause some problems, but it's more traumatic than it is anything else to see these packets, these egg packets come out in the feces. There are good medications for this too. Again, just check with your veterinarian to find out what you need to do with it. These little guys are northern fowl mites, and they occur most frequently in northern climates. They spend their entire life cycle on the bird. They can spend some time in the litter and in the coop. If they've had a full blood meal, they can live for 3-4 weeks, offside the bird. But generally, if you see mites crawling around on your chickens during the day, this is what it's going to be. Look at the vent area. If it looks like it's kind of salt and peppered, or kind of it's got some matted feathers and things like that, that's a good indication there might be mites. Look closely, and if it looks like they're moving around, you've got a peg. That's what you've got. And so they do take a blood meal, and there's different stages of them. And so treatment of mites and lice both require staged treatment. You have to do it more than just once. And I'll talk about that in a minute. There is another mite called the red roost mite. Now, the roost mite will usually feed on the birds at night and then go hide somewhere in the daytime. So the best diagnostic tool you have for if you suspect you have some roost mites is a hammer. You just go in and knock off one of the perches and look in the cracks, and if you see something that's looks like moving blood down in there, then you've got the red mite problem. They can do some real damage. In fact, there's cases where the red mites have actually killed birds. So both of those can occur. When we talk about treatment, you'll do the same for both. However, I do want to talk a little bit first about lice. Now, lice can be brought in from wild birds. Well, the northern fowl mite can too. And but you get them in there, and these kind of cigar-shaped oblong things. If you look under the wings that are down by the skin itself, sometimes you'll see these. Now, for all intents and purposes, the lice that commonly infest birds do not suck blood like the mites do. The mites will actually suck blood, and you can get some anemia from it. These creatures will just kind of eat the dead tissues around things. There is a depluming mite that will cause feather loss. However, they don't actually cause anemia by sucking blood. Now, this is the underside of the beak of a bird, and at first glance you think you've got some white and some black feathers here. Well, actually, if you look more carefully, you'll see these things are packets. They're egg packets from lice, and you can see that not only in the feathers under the throat, but with really bad infestations, it'll cause the feathers to look like in the wings and in the body, look like they're deformed because there's so many egg packets there. So the only thing that's available on the market right now are some permethrin products that you can use as a dust on your birds, and you can use these for lice, and you can use them for mites both. But these things go through life cycles, and at certain stages they're not susceptible to be killed. For instance, you could put the product on this bird, and those egg packets are still going to hatch and form little nits. So the trick to control of mites and lice is that you've got to do it fairly regularly, and at least every week, every 7 days for 3 weeks, and you might have to go further than that. As I mentioned, the mites can live in the litter. They can live in cracks and crevices inside the coop, and so part of your demiting of a chicken flock is to make sure that the coop is properly treated with insecticide, and you get all those cracks and crevices taken care of too. Now, this is a fairly common situation, particularly in older chickens. where you'll start noticing that the shanks and the toes of your bird may start to become really roughened, and it looks like the scales are starting to point up. And if you go in there and do a deep scraping between these scales, what you'll come up with is this little guy. This is the scaly leg mite. It's a Sarcoptes mite. It looks a little different than the ones we've looked at before. Um, these mites can cause a lot of problems if you don't treat them. If you notice that you might have a situation where your chickens are starting to get these on their toes and their shanks are starting to look rough, then you want to treat the whole flock with them. And if you treat early, you can stop any further damage. But if you get these to this point, um, there's actually some bone damage and some tendon damage by this time, and that bird will never get back to normal where it should. It's very easily treated. Just go down, buy some Vaseline, and put some Vaseline down inside those cracks. Make sure you treat every bird in the flock. And the idea here is to smother those mites as they're down inside there, so they just can't get the air they need. And you'll have to retreat a few times to make sure you get everything. But in the process, the Vaseline will help soften those scales. And if they're not in too bad a shape, they can come right back and be normal again. So the reproductive abnormalities are important. Now, a point that we need to make is that the hen can store some of the calcium that it uses for the eggs in special bones called medullary bone, but it can't sustain long-term egg production. And that's the reason why when you have laying hens, you've got to have a layer diet. And those layer diets are 3.5 to 4% calcium, whereas the growers and the starter diets are about 1%. And so if they don't get that extra calcium, you can start having problems with either or all of three things can occur. First of all, they'll quit laying eggs. They'll lay real fragile eggshells, or they'll start having skeletal problems. And so that's kind of important. And here we see some old laying hens that in some time in the past have had some sort of a rickets that's causing those keel bones to deform. A couple of things that these are kind of nebulous, and I want to talk about them for a minute. I get calls a lot about swollen abdomen. My hen is walking kind of like penguin, and so what's wrong with it? It's kind of swollen down there. Well, oftentimes, and 90% of the time, what's going to occur, if this is particularly a young bird, and not an old bird where it could have some cancer problems in there, but as those egg yolks are deposited into the oviduct from the ovary, sometimes they'll miss and they'll go down inside the body cavity or the coelomic cavity and cause a lot of inflammation to occur. And I suspect that almost every hen will have a missed yolk occasionally, and they'll be able to take care of it, but sometimes they can't take care of it, and it causes a real inflammatory problem. And sometimes there may be multiple missed yolks in there, and eventually a lot of this stuff will get infected with E. coli, and then you have a bad situation where the chicken has a lot of fecal material on its vent, and it just has a swollen abdomen, and usually that's what it's caused from. It's usually terminal, at least in my hands. Not many birds are going to respond to that. If you do have a pet or a particular bird that you're willing to have some veterinary work on, you could always take it to your veterinarian and see what they can do. But generally speaking, it's kind of a death knell for them eventually. Egg bound. Oh, one thing I wanted to mention on that too is sometimes you can get cracked eggs in the oviduct itself as they're laying them, and one of the major reasons for that is that you have your perches too high, or they can't access the nests correctly, and they have to fly and they have to hit the ground hard and stuff like that, and so you can get some checks and things going on in the actual oviduct itself that causes some of this inflammatory process too. So make sure your nests are the right height, about 18 inches from the ground, and that they can they can easily get into the nest boxes from the perches. Egg bound is something that everybody seems to think that they've got a chicken that's egg bound. And I suspect that most of them is not an egg bound situation, particularly in the modern laying hens where they're bred to be egg laying machines. And this is something that doesn't occur very often. Um, uh, there could be some growths in there. There could be some twisting of the oviduct. And on rare occasion, maybe there is an egg binding, but the classic egg binding that you hear about in parakeets and things like that very rarely occurs. I think what happens most often is we're getting back to our calcium situation again, where the birds have a low blood calcium, and that calcium is necessary for those smooth muscles in the oviduct to push the egg forward and get it out. And if for some reason there's a low blood calcium, they've run out of calcium in their bones, and there's some not enough that they're getting maybe in their feet or something like that. They may have a temporary situation where they just can't make those muscles work properly, and so again we get back to a good commercial lay feed on these laying hens is the best thing you can do for them. Okay, now the most common thing that I run into is, and most people who buy a few chickens will run into, is Marek's disease. And the clinical sign that is most often reported is that they can't walk. They've got a leg that's being dragged. This this disease, there's certain strains of birds that are more susceptible to it than others, and right off, you really don't know until you get a particular bird. And also, there's different strains of Marek's disease that affect chickens in different ways too. Some are more severe than the others. Um, the some of the lighter breeds, like your Leghorns, are going to be more prone to it. And generally what will happen is that they'll get up to be about 16 to 26 weeks of age, and right when they're starting to lay, and then they start getting paralyzed, and you'll start seeing things like this. And your best bet is to request, if you can, to the hatchery to vaccinate for Marek's before you get the birds. There is a vaccine available that you can use after the chickens are placed, but virtually every chicken in this world is going to be exposed to Marek's disease virus sooner or later, and most of it is sooner. And so that's the reason why the hatchery vaccination is going to give you the best protection on it. But that's a fairly common thing that occurs. And this disease causes some lymphoma growth, and what you'll find is some of your birds may have kind of I apologize for this picture, it's out of focus, but I think you can appreciate that pupil is not circular, and so it does deposit some of these cells into the eye. And also in some cases, and this is mainly in your broiler type birds, you're going to start getting a swollen liver too. In most of your layer birds, it causes a neuritis, or a inflammation of the nerves, and that's the reason why you end up with chickens that have one leg or one wing that they're dragging. So the best prevention of this is vaccination at the hatchery. We talked about rickets again. Another plug for good commercial starter feed. We're talking about rickets and chicks, because you can get some of that where they'll be reluctant to move. They'll run a few steps and then sit down on their hocks, and they'll have a soft beak, pliable legs. You almost get the impression you can bend those things into a pretzel. And if you catch this early and get them on a different feed, most of this stuff will resolve itself. Porosis or slip tendon, another situation where some vitamins and other things will cause these problems. With good feed, you shouldn't see a lot of this. This is often a problem in broiler chicks, more so than it is in our layer chicks. And normally, if they have one problem, they have multiple problems. And so even though this may appear, let's say that it's a skeletal problem, obviously that leg is twisted out and things like that, but look how poorly feathered it is and everything. And so it does, it's a multiple vitamin type deficiency. In fact, in this case, the feed had been left out in a warm place for a long time, and the vitamins just kind of dissipated and had that problem. And some other ones that occur in the backyard is the neighbor's dog. Keep your chickens penned in the best you can. Also, wild or feral animals can get in and cause some real damage to your chicken coops. I used to live in a place where there were mink ranches around, and every once in a while a mink would get loose, and it could wipe out a whole coop of chickens in a hurry. And so protect them the best you can that way. Some toxicoses that may occur, rodenticides. The problem with these is that I get calls and saying, well, my chickens have got into the rat poisoning or whatever like that. When can I eat the eggs, or what's going to happen? And these things are not feed ingredients, and so there's not withdrawal times or anything like that. And so as veterinarians and extension folks, we can't give them a withdrawal time on this type of stuff, because once they eat it, they there's no experimentation or information to tell when it's out of their system. Toxic plants, the major one, at least in a lot of areas in the northern area, would be just your castor bean that's planted as an ornamental in your yard. That's probably the main one. But I want you to think of something about insecticides and herbicides for a minute. And so I'm going to leave you with this picture. And incidentally, this chicken coop was built by a lady that just went online and looked and saw all the best things of the coops that she could find. And then she went out and bought her own material and built this coop, and it looks commercially made. It's quite the deal. You can see that it can be lifted up on casters and moved from place to place. So you've got some content chickens down there and everything, but just look at the lawn for a minute. First of all, do you see any dandelions or weeds in there? When was the last time that herbicides may have been used on that lawn, or fertilizers or insecticides? And so sometimes we don't think about that as we turn our birds loose out in the yard, but I think it's something to consider, that we want to make sure that there's plenty of time in between, if we do treat lawns and yards, that the chickens won't get into anything inadvertently on that. So with that, Jackie, I think that's about the extent of it. So I'll get out of the screen sharing so I can see if there's been any questions here. So
okay, I have some questions that weren't asked but came up from people sending me questions that I know are currently in the Ask an Expert. You had mentioned the worms getting into the eggs, and there is currently an Ask an Expert question open. I can't remember who has it right now, but they found a worm in the egg and they ate it. They ate the egg. Didn't realize it was a worm till they had taken a picture beforehand or whatever. And I just want to make sure that people know you can't get worms from chickens.
Yeah, no harm, no foul on that one.
Especially since it was cooked, it was probably
yeah,
dead anyway. But
that's correct. And there are a number of different kinds of roundworms that do infect chickens, but they're not ones that humans get.
Yeah,
So,
I mean, the more species specific.
yeah.
Okay, there was one question. Are the states around California monitoring for Newcastle, since California has the outbreak, but are the other states monitoring? Do you have any information on that?
I can't speak for any state other than Utah, but we monitor very regularly. All the commercial operations in the whole state are monitored for Newcastle. So we are watching for that.
They're not doing what California is doing, where they're going flock to flock looking for it.
No, there's no need to. If you have virulent Newcastle, you'll have dead birds, and so these commercial people are monitoring for that, but also for their vaccination programs too. And so we have full information on all the commercials for our state. Now, what the other states are doing, I don't know.
Yeah, I didn't think you would either, but I would imagine that if there is a sudden death, then any of the states around, like I know Nevada has had it, right?
Nevada had some, and
Mm.
well, no, it was Arizona and
There's
us. It was Arizona and Utah that had some of that last in 2019. Yeah,
So if you had a positive, then you would check around that positive, but you're not out looking for it.
you bet. And there's a whole protocol in place to if a positive does come up, what to do. And so we're all the states are in that mode.
Right. There was a question on, is there a vaccination protocol for heritage breeds? I think that would be the same as any smaller backyard flock. Most of them have heritage breeds.
Sure, and again, unless you've got a problem, I think a lot of us are kind of tuned into, we have a dog or a cat, and we've got to vaccinate for parvovirus, and we've got to vaccinate for distemper and that kind of stuff. And there's all these things, and they're very important for pets like that. But for chickens themselves, there's enough isolation usually that that you shouldn't even mess with vaccines at all unless you have to.
What about if you're going to exhibitions?
That might be a different situation. Some of that might depend on what your state will allow. Sometimes you can cause problems for others too. For instance, laryngeal tracheitis vaccination, even though it might be legal to do, you take those to a fair and everybody else is not vaccinated for it, you can give everybody a problem. And so you've got to know what you're doing before you just go out there willy-nilly vaccinating.
Yeah, it depends on the type of vaccine as
Right.
well as the disease. Here we say if you don't have a problem, don't vaccinate. I think
Absolutely.
the main problem that some people have been vaccinating for in some states, like Florida, we do have somebody here from Florida, would be fowl pox, because they have mosquito problems.
Yes.
And fowl pox could be a problem. But what about Merrick's? If you're buying from a hatchery, should you pay the extra for a Merrick's vaccine?
If for me, I would. I think it's worth it.
But if you've originally bought Merrick's vaccinated chickens and then you're hatching out your own chickens, should you be vaccinating your own chickens?
I think it's kind of preference. If you have a problem with a hatch, and then you say, okay, yeah, maybe I better start vaccinating the subsequent hatches, but just to go ahead and do it, you may not necessarily want to do that. The problem with Merrick's is that the vaccination is in there. You want that in there before the wild type hits, and if you're just hatching your own eggs, you're going to have that virus all over the place anyway. Those chicks are going to have virus into them immediately, and so you lose the efficacy on the vaccination at that point.
So even if their parents are vaccinated, you don't necessarily want to vaccinate the chicks that you hatch out?
I wouldn't, and at least the birds that I've ever had never had any problems with them either. So.
Okay. Question just came in. How is the best form to medicate chickens?
The best form?
That's what it says.
Okay. You want to use some sort of container where you have an exact amount of, so you can measure your water, either in liters or gallons or whatever it is. And then if you just have a small flock, you mix it up in something like that, and then you put it into their water containers. It's important that you clean out those water troughs, rather they're fountain drinkers or whatever you use. Make sure everything's clean before you put that stuff in there. But then measure it out. Just don't throw it in there.
Right. A lot of us in extension get questions about treatment of mites, lice naturally with diatomaceous earth. What are your feelings towards this as a treatment?
I think it's a good ancillary treatment to put in your building. And it'll also help with some other types of things too, darkling beetles and so forth. But I think your permethrins are going to do you the best good to actually treat with, and they're very harmless too. They're not as long as you don't put them in water where fish can get to them or anything like that. But as far as human beings go, dogs, cats, and so forth, it's a very harmless thing.
And there are natural ones as well as
Yes.
peripherums to get some natural ones. But I find that it just providing a sandbox for your chickens to dust bathe in is even, better than the diatomaceous earth. What do you think?
I think so. You can actually put some of your permethrins or pyrethrins right in there and help out. If you look at diatomaceous earth under a microscope, it might scare you a little bit. Um, so, because it is kind of sharp, and I don't know if I'd want to subject my chickens too much to that. But as far as in the litter and things, yeah, that's a good practice.
Yeah. Okay, I'm not seeing any other questions, and it is the top of the hour. So thank you very much. Dr. Frame, you did a really good job as usual. Picked up a few tidbits myself. Thank you to those that attended. If you were here earlier, you knew that I said that, well, first, for those with 4-H, on Thursday, we're doing a webinar on the new regulations for the National 4-H poultry barbecue contests. We do have a national chicken and turkey barbecue contests if you would like your states to participate. June, the webinar is on butchering chickens, and the July one is on managing egg-laying hens. We're working on ones for predators and raising meat-type chickens and cooking turkeys, proper handling of turkeys for Thanksgiving and Christmas. So thank you everybody for attending, and hopefully we'll see you in June rather. And as I said, this is recorded, so the recording should be up today or tomorrow. So again, thank you, Dr. Frame. You did a really good job.
Thanks all. See you.